sometimes it's pH. Sometimes there's something going on with you. And I think that's something that you learn. You get to know your own body, I think, and how you feel with things. So one thing I am going to say now, which I'm afraid I'll forget later, after having 4 lines, I've learned that the placements can be much different. They can be higher up, lower up. If you are someone who's going to be getting a new line, or if you have to have your line switched out, one thing that I recommended to someone a little while ago was to take even just a headset and tape it onto their chest in different areas and find out what feels best for them. Because women, for example, with their bras and things like that, it can be hooking in, or if you like to wear low shirts, well, maybe then you want to have it up more up this way, or so just try that maybe for a few days and see what, you feel comfortable with. And, some people go in and they mark an X with a pen on their chest and say, this is where I want it. So definitely think about doing that if it's becoming time for you for IV therapy. Let's see. I think there is a YouTube site of which I showed some people, and it's animated, so it's nothing where you're going to see an actual patient get a Hickman catheter. But I am going to post it on here. I'm hoping after in the chat session or something, or I can look for it and then post it. So from there, I'm going to hand it over to Marian.
Sorry, technology had to unmute me. Hi, folks. My name is Marian Roth. I'm from Southern Ontario. I was diagnosed 10 years ago with PAH, which is idiopathic pulmonary arterial hypertension. For my age, I've been seen as pretty active. I'm involved with volunteering at our local nursing home, doing therapy dog visitations, involved with competitive dog obedience, and active within my community and my church. So yes, got a nasty disease with no cure, but no, it's not holding me back. I'm on the go, and many of us can get on the go, but not all of us, because as we'll probably hear a few times today, this disease is individual, and the treatments are as individual as the diseases, and it hits everybody differently. When I was diagnosed, I was short of breath. I couldn't barely get from one room to another without taking a break. I was fortunate in that it was just a matter of weeks before I was diagnosed and started on oral therapies. Not long after the first one, they started a second one. I got 4 years out of oral medications, and then we started to progress in the disease again. And that's when sub-Q was suggested. Now, sub-Q is the short version of subcutaneous. It is another form of IV. It's another form of infusion therapy. IV is, like Sonia said, is a Hickman catheter that goes in through your chest. Sub-Q is a little catheter on a little round plug that you can insert yourself into your tummy, your thigh, your back, your arms, wherever. It's a little. Sonia, you got slide number 1, please. It's a little catheter that you can do all by yourself. There's a couple of different ways to do it. I used the Clio when I had it, so it was just like the children's stamps that you do for dipping the ink and give it a press, and it goes in, and it's a little injector that shoots the needle into you. Very small, very painless. Not managing, Sonia, turn it over to Samantha, see if she can get it. Anyhow, I'll wait for the photograph coming up and I'll just carry on. This sub-Q delivery system is very similar to what the diabetic folk have. And the diabetics have the same tiny little pump. They have the same connecting lines. Here we go. There we go. Okay. So I can't move it up my screen, but you will see there the little black pump. That's all the size of the pump is for sub-Q. Can be stuck in your pocket. It can be stuck, some ladies stick it down their cleavage, and that works quite well for them. Myself, I just stuck it in my pocket and away I went. the delivery system is simple. You've got the little cartridge, you've got your bottle of medicine, you've got a line connecting into it, and it's not a big deal. It's easily taught and easily handled and very quick to do. And generally, the cartridge is changed every 2 to 3 days. Okay, Sonia, I'll let you take that one down. When they suggested the sub-Q, I was kind of like, okay, we'll go with it. So we went along with it. I felt like a dog connected to a leash, and I had a shorter leash than my dog did. My dog Riley works on a 6-foot leash, and my leash was shorter. So I couldn't get any further from my pump than what I had in leash. So I wasn't impressed about that, but we got by it. I went on sub-Q and I was on it for 2.5 years. The drug they had me on was Remodulin, which is the only drug that can be administered for sub-Q. I thought maybe it was just in Canada because we have different regulations up here, but on checking with McKesson Pharmacies this morning, they said no, Remodulin is the only drug for sub-Q in Canada and the US. So it's just not a North American thing. I did well on the sub-Q, didn't hold me back much at all, other than my leash was too short. And then I started to slide. I wasn't doing so well, was starting to get short of breath again. And my doctor, my team is in London. I work with Dr. Mehta. He suggested that the Remodulin might not be absorbing properly, which happens. So the area around the little injector was getting too hard very fast, and it just wasn't letting the drug absorb. So he suggested that we throw another drug in there as well and see what happened. We tried another drug for a little while and that didn't help either. So yep, now my option was onto the IV. Now, for me, one of the reasons why I was put on sub-Q to start was where I live. We're a little further away from the London clinics, about 1 hour and 15 drive. And sub-Q has a half-life of 4 hours. Now, for anybody not knowing what a half-life is basically how long that drug is going to stay in your system and do any good. And if you're off of it for 4 hours or more, then you're going to start to notice the side effects pretty strongly. Now, maybe Carl will tell you about the half-life of his when he comes up, and I'm grateful that I'm on Remodulin for where I live. Okay, can you flip up slide number 2 for me, please? Somebody's working on slide number 2. So really the biggest change from sub-Q to IV for me was only the delivery system. The side effects were the same for everything except the one main factor that you don't get with IV that you do get with sub-Q is the pain. You may have seen or heard people talk about Hell Week. Well, Hell Week starts usually about 3 days after you put your sub-Q site in and lasts anywhere from 7 to 11 days. And that's can go from very uncomfortable to very painful, depending on how you are with your drug and what your doctor allows you to get in pain medication to fix said discomfort. But that's the main difference there. There are more risks. Okay, I don't have this.
Is this slide up yet, Marian?
No, I've only got slide 1. I don't have slide 2. There are more risks involved with IV, like Sonia said. Most folks do fine with it, but I can name other friends. There we go. Okay, bring them on back down to the middle.
Okay, so was this one on the screen at all when you were showing it?
No, this is the first time I've seen that.
Okay, I shared. That's weird. Okay.
That's okay. It could, but it's going up top. Bring them on back down.
Yeah.
Okay. Most folks do just fine with IV, but I can name friends, Sonia, a whole bunch of other people. I won't name names on here, that have had horrendous problems with infections with their lines. And it's not anything they're doing for the most part. It's their body reacting against either the drug, the adhesives, just their skin reacting to whatever, and they can end up with terrible infections outside, which can creep up the line and end up like Sonia did, where you get the sepsis going through your system. So that makes it just horrendous. And I second guessed myself whether I wanted to go on it. I'm 4.5 years on IV, and I haven't had any form of infection, rash, or anything. So I'm in the crowd on the other side of the fence that's doing excellent with that. Okay, on the little tray here, you'll see I threw a ruler on there to give you some idea of the size. Now the pump is at the top on the left-hand side of the page, and that's what they call a CAD legacy pump. And the little gray thing with the blue cap on it is your cassette, and the both of them connect together. And when you fill it up with your medicine, that weighs 2.5 pounds or 1 kg, depending on what system you work in. So now you are connected to 2.5 pounds, and you can put it wherever you want in your body. If you've got enough room to strip that down the cleavage in your bra, ladies, go for it. The men, I know many guys that stick it in their pocket in their cargo pants. There's another slide I'll show you in a minute with different cases for it, but that is your delivery system. How do you work that? Well, there's a small syringe here. You take the small syringe and you draw whatever amount of medicine you want out of the little bottle. That's my Remodulin bottle. That does me 14 days, and I change every 2 days. So there's basically 7 doses of medicine in there. The big syringe on the far right, that is for the saline, which is hanging off the little monkey's tail. See that little green thing up top there? That's Joey, and he's a banana hanger. And that's where I hang my saline bag. So as I'm not trying to get it cornered on the table or falling down on the floor, that's Joey. So that's where I hang my saline bag. So I take whatever I need in saline to mix into my cassette, add my medicine to it. And then on the bottom right-hand corner, you've got my extension line. And that little blue clip, the little blue adapter there, connects to the little blue adapter on the end of the little cassette on the left-hand side. Those two go together. And you'll see a little purple connector on that ring of line. That little purple connector gets connected to you. So you've got your Hickman line exposed, and it's got a little connector on the end, and the two of them get connected. And when that's all said and done, you're connected. Now, on the top left, just over from the pump, is a little alcohol wipe. And I use that all the way, I use more than one, obviously, all the way through the process to clean off my lines and my connectors and whatever. And on the bottom, you'll see a little 3M there with a long pouch. That's an alcohol swab stick. And I use that to clean out where my line is connected to my skin, where it comes out of my skin. I clean that 2 to 3 times a week or whenever I've had a shower to make sure that I'm all clean. The little red dot at the top, that is a line cap. So if I'm going to do, didn't hear this, if I'm going to go do a freedom shower, I connect that to the end, the little purple end that's connected to me, and I disconnect all my pump stuff and I jump in the shower for a freedom shower, so I'm not connected. When I'm not doing freedom showers, the whole pump system and me goes for a shower. I put the pump up over my shower, and on the outside of the shower, I have made a little bag to put my pump in. Some people that don't have sewing skills like I have, I've suggested to use a coat hanger or something to that effect. And that coat hanger hangs on your shower, and you just hang your pump bag on there and away you go. That gets you in and out of the shower. Okay, these little bags here, the little black bag is what comes with your pump. It usually comes that it's an over the shoulder or across your chest type holder. I've adapted mine. Mine is like a fanny pack. The blue one, I opened the case, is a little heavier case. And if you ask your pharmacy, they'll supply you with that if they haven't already. And I like the heavier case when I'm traveling. It's not as apt to get bumped, and you're not apt to have a button going off that will beep at you, and then you hit the panic button just till you look down and see what it's beeping for. To change my whole system, when I start from scratch and go round up all my equipment, which I keep in a 5-tower drawer, you know, those plastic drawers that you buy at Canadian Tire that are yay high. Well, I keep all my stuff in there. So I take my tray that all my stuff was shown to you on. I take that, I go collect up all my stuff, put it on the table, get everything all ready. And from the start of that till I'm all hooked up and ready to go, I can do it in 11 minutes. So people, 11 minutes every second day to keep you going, keep you alive, is well worth the effort of being hooked up to IV. Some side effects that you get with Remodulin. Hang on, I think I've got one more slide there, Sonia. If I got one more, can you slip me down to the, yeah, this one here, people, this is the ultimate of fun. This is what you call an Aqua Pack. Okay, remember that name if you go on IV and somebody tells you the world is shut down. This gets me swimming. I put my pump in the Aqua Pack, and out the top part where you see the black clip there, that's where my line comes out of, and I can go swimming. Now, depending on where you're from, in the Ontario clinic that I am at, my doctor allows me to go swimming and I don't have a problem. I don't cover my site with IV special Tagaderm or special IV 3000 or anything like that. It's not required. After 6 weeks of insertion of the Hickman line and the stitches are out, I was told I can shower without it. If I can shower, I can go swimming. I just needed to find something to do with my pump. And this is the Aqua Pack I have for my big pump. And when I had my little pump, I used the diabetic Aqua Packs and I went swimming. I've been in the ocean, I've been in swimming pools, I've been up and down water slides. So talk to your team, make it happen. Okay, back to side effects. Side effects for the Remodulin. There are as many side effects with Remodulin as there are with any other drug out there. You can have what we call jaw pain. No, it's not a toothache. It's just a pain, kind of like biting into a really sour lemon, and your jaw just goes, whoa, what was that? And it will happen many times for many people. Sometimes they have the achy jaw for quite a while. Sometimes it's just the first bite when you're eating something, and then the rest of your meal is wonderful. We get headaches, diarrhea, nausea, foot discomfort. And those are the ones that people notice most often. There's a whole list of side effects, the same as any other drug. And it's like, why am I taking this? It's going to kill me. There's 1,000 side effects, but most people just see these regular ones. I haven't done a whole lot for side effects treatment, just because I've been fortunate and the side effects I've had are not that severe. Even with sub-Q, when I had the side effects, they were not that severe that I couldn't handle it. I was offered, I had been offered morphine for the site pain, and I turned it down because I didn't want on to an opioid. And I opted to just do ice rings, baby teething rings that are in a circle, and just put that over your little Clio and, you know, hold it down tight, or an ice pack if you don't have that worked well. With the IV, I haven't needed to take anything at all for it. I've been very fortunate that way. Caring for my site is minimal for me. I clean it off with the swabs after a shower, or where I've been anywhere swimming or anything like that. I clean it off really well. That's about the extent of anything I have to do with my site. I've been fortunate. For the most part, all I can say is Remodulin has saved my life, regardless of its delivery. I found a new quality of life. No, it did not give me back the life I had previous to PAH, but for me, I do anything I want. I got it made that way. Sonia, I'm done yapping unless you've got anything else for me, or you come back at me after. You're muted, Sonia.
I know. I just keep touching the microphone instead of going to mute. I feel like the microphone should take it off. All right, Carol, we'd love to hear from you now.
Thanks, Sonia. Great presentation, Marian. I mean, pretty much everything you talked about is the same thing. I'm Carl. I was diagnosed with PAH, idiopathic PAH, in September of 2018 is when my diagnosis came through. Mine came on real quick. In a matter of months, my PH developed in a matter of months. Just to kind of back up a little bit, real short, in November of 2017, I was diagnosed with AML, which is acute myeloid leukemia. Exactly. What the hell is that? I never heard of it either until all of a sudden I got it. Mind you, I never heard of PH till I got that either. And so had to go through all that, which is a complete other story for another support group. But having said that, I got a stem cell transplant in March of 2018 and was, you know, mentally looking forward to getting things back on track and hopefully surviving that and all the rest of it. And then during the summer months, I just, you know what, my health just deteriorated to the point where I ended up back in hospital with congestive heart failure and no one knew what the heck was going on. Again, I was fortunate enough to be at the hospital that actually has the PH clinic and the PH team in it. So after they ran a couple of weeks of the regular tests that they would do on someone to find out what the heck's going on, they rightly brought in the PH team. I did a right heart cath and did everything else. And you know what? The day after my right heart cath, Lisa Lee walked into who's the resident, the nurse. She basically walked into the hospital room with this little machine and said, "Welcome to your new buddy. You're gonna, you know, I had during the cancer treatment, I had a Hickman line in for all the drugs they were giving me there, and I had that taken out. And they said, no, you're gonna get another Hickman line. Not as big as the one I had in. I had a 3 lumen. This is the ones we have is what they call a 1 lumen. It's just the one tube coming out. So anyway, yeah, I wasn't too happy about that, to say the least. You know, the thought of all of a sudden being hooked up to this damn machine, what's going on. So there was a lot of mental anguish about that. But you know what? After they put me on that thing, by the 3rd day, I was up out of my hospital bed. It was that big of an initial turnaround for me, and I was able to walk around the hospital ward again. And I couldn't get up out of bed when they put me in hospital. So yeah, that's what it is. When it comes to side effects, Marian covered a lot of the side effects with Remodulin, but there's pretty much the same ones. I just listening to you, Marian, is what I get with Carapol. The jaw pain is something that is a real challenge. I mean, even brushing my teeth in the morning, every once in a while, you know what, I find it beneficial to call out loudly when I get the pains and I'm brushing my teeth, much to the chagrin of my wife. But you know, it kind of helps. I guess it's like, you know, but that hurts. We make a joke once in a while that, you know what, if you don't want to experience that first bite jaw pain, just don't ever stop eating. But that's not necessarily good for a person either. Yeah, absolutely. Foot pain, constant headaches. I kind of live in a cloud in my head for most of the time. It's just where I'm at. Some days are better than other days. I think, you know, as a side effect, I guess what I use the word unreliable, even though my wife doesn't like me to use that word, but I feel that sometimes I'm unreliable, meaning every night I go to bed with a list of things I want to do tomorrow. And then I wake up in the morning and it's like, oh, I don't know if I'm going to get to any of them because of the way I feel. Having said that, I have way more good days than bad days. And that happens over time. I myself have never had a problem with my Hickman line. Touch wood. I've been fortunate. I know absolutely lots of people that have had issues with infections and things like that with their Hickman line. I've been fortunate with both Hickman lines that I had, that I have not had that problem. So again, touch wood that one's not my deal. I too, when I first had the Hickman line, I put the plastic thing on to go for a shower, and I had the Tegaderm patch on all the time, and that was just, after a while, I was like, yeah, enough of that. I mean, if having a shower without a plastic shield on is gonna turn my life around, well then, what's the point? So anyway, yeah, I don't have any problem with it. I don't wear anything on my Hickman line anymore. Just as Marion says, I just keep it clean, as simple as that. But it's definitely not, and it's not rude to look at it. If you want to look at it, I'm going to show it to you right here real quick. I mean, there it is. I mean, it's a little flipping tube, right? It's nothing major. Whatever, I cover it up with my shirt. I wear my shirt normally, so it's not a big deal. I wasn't given a choice whether to go on Carapol or not. In my particular situation, it was do or die at that moment. So that's where I went. Do I want to get maybe moved over to orals at some point in time? Absolutely. Who doesn't want to get rid of their pump? I mean, really, in an ideal world. And my cardiologist and PH team are aware of that. I bring it up all the time, but I try not to. I'm not trying to be too aggressive with it, because I have to take their advice, and they saved my life. So why am I going to say no to them regarding that? One thing that happened to me is they were titrating me up. They're increasing the dosage level of Carapol. My side effects went through the roof, and I became what my wife referred to as the blanket boy, because I would literally just sit on the couch with a blanket over my head and let the hours roll on, because I was just feeling so crappy. But the nice thing about it, if you will, is that the record keeping that goes on with your dosage, especially at the start when they start titrating up. And one of the PH clinics, I went to my doctor and we're having the discussion. I said, I just can't do this. I said, so I went back to my records. When was the last time I was functional and feeling okay before they titrated me up? So we had a good discussion, and we brought my levels down, or the dosage down, the infusion rate down, and things turned around. And you know what? I was able to function once again. Everything's fine. It's the first time I ever had a doctor apologize to me. When he looked at me and says, "Geez, I'm sorry we put you through that, Carl, but it looks like this is where you're going to be." Now, I just had a right heart cath 3 weeks ago. Things are looking good. My echoes look good, so I'm stabilized out. So I guess I'm at the rate I'm supposed to be. And why I tell that story is to, if you get on IV meds and experience all this stuff, it's really important to be clear and open with your PH team with what's going on. Try and resist the suck it up buttercup mentality, because you know what? Pain is pain, and side effects are side effects. So be very clear with what you're experiencing, and there may be something they can do. In my case, we dialed back down my infusion rate to something that would still work for me, but wasn't causing me a lot of side effects. So open communication is a big thing. I know a lot of us have multiple issues. A lot of us have multiple health issues. I've got 4 doctors teams that I go to. And it's so funny, whenever I have a medication change, I send an email out to all my team, my various teams, saying, by the way, this doctor did this to me, FYI. And it just keeps everyone in touch with what's going on, because a lot of times the side effects I found for me, I wasn't quite sure which side effect, which drug was causing which side effect. We came to this, I'm taking this massive medication and I'm feeling like crap. Well, which one is it? So what we did for me, and it was through discussion with all my healthcare teams, is we stabilized out. We said, you know what, no more changes to medication for, 6, 8 weeks, 6 months, and let's just kind of stabilize out. And then let's make one small adjustment to medication, whether it's infusion rate or an oral med for something. Let's do that gradual, so that we can kind of be in touch with our, I can be in touch with my body with what side effect was affecting side effects. So that's another thing to consider if you switch over to IV meds. Absolutely, you're going to, Marion refers to Hell Week, absolutely. But on my experience, things kind of settle down as we settle down, or as I settle down, and you know, is to what's the word I'm looking for? I'm reading a little text here from Ella, so that's why I'm losing my thought. You know, it's important to be in touch with your body. This is what I'm saying. And the side effects are just a side of it. It's just it's what's going to happen. So how do I mitigate some of the side effects? You know what? Yeah, absolutely. Tylenol is my friend. I've got a couple other pain medications that I use on occasion that are prescription pain medications on those days when things are just not working for me, which isn't too much. Having said that, you know what? Well, I still try and be as active as I can. You know, I got an e-bike and you know, thank goodness, even as a panelist attending these things, I mean, looking at that Aqua Pack, I wasn't aware that was even available. So thanks, Marion, for that. I'm certainly going to be investigating the Aqua Pack. When it comes to mixing the meds, thank you. Pretty much what Marion had showed you there. My pump's a little bit bigger. I don't know if it's just a completely, you know, a newer version or whatever, or if it depends on the drugs or not, but my pump's a little bit bigger, and with the big bags of saline now, I mix 2 cassettes at a time at a sitting, because that's how much saline is in there for my cassette. And I use 2 bottles of Carapol per cassette, whatever that works out to concentration. I'm not quite sure. Some would know that stuff better than me. There was a time when I was diligent about putting the labels on the cassettes, and now I just make them up, throw them in the fridge. You know, half-life, that's a good question. I don't know the actual, what the half-life would be. Look, you're holding up there. I know that I can do 7 cassettes at a time in the fridge, which I used to do all the time. And now I'm kind of lazy, and every second day I make up 2 cassettes, unless I know I'm going somewhere, in which case, you know, both my wife and I'll sit at the table and we'll do it 4 or 6 cassettes, just because it has to be done in even numbers because of the saline. I too have the 6-decker from Canadian Tire, where all my meds sit in, to do that. And I can whip off 2 cassettes in about 20 minutes. So, you know, pretty much what Marion says, 1 in 11 minutes. I can get 2 done in about 20 minutes. Where when I first started off, to be quite honest, it was taking me close to an hour to do 2, you know, to do a couple cassettes, because, you know, you're fidgety and all the rest of it. Now it's like you kind of do it. I don't want to say with your eyes closed, because you don't want to mix your meds with your eyes closed, but it's, you know, it just becomes automatic, and you just do it now. As a matter of fact, what I did for my family and friends when I first got on it, we did a Facebook Live for all my family and friends, because I got family across the country. And I said, here, this is what the old man has to do every time. And we did a little Facebook Live of doing cassettes. So that was kind of cool. A little tip, I don't know what people use for their Hickman line. When I was during cancer treatment, again, like I said, they had a Hickman line. So they gave us these, which is, and you can just make these. It's just, all it is, it's a leather, you know, it's a chunk of leather you get from Michael's or wherever, 2 clips. I'm showing them two little alligator clips. See how they open up, and of course 3 beads to keep everything separate. And then all I do is I got my Hickman line here, and I put these things. I clip this on. This is what they did to me when I was in hospital. Right, hangs off my neck. I don't know what everyone else uses. I don't have pressure now on where it comes out of my chest. Swim, shower, sleep, everyth's fine. You know. There was lots of things that were going on when I had that pump, you know. You know, how was I ever going to be intimate again with this buddy that's with us now and all the rest of it. But you know what, you make do. After a while, you make do. It's absolutely fine. I hang mine over my shoulder when I'm just roundabout, but when I go out, I have the blue case that Marion showed up. That's what I use, and I hook it into my belt loop. If I'm wearing pants that have a belt. And you know what? I put that on the side, and the tube comes out the bottom of my shirt into the bag, and life is good. It just looked like one of those fanny pack guys. So, which could be good or bad. I don't know. But I think that's about it for me. Like I said, it's it takes some getting used to, but it's not undoable. And it also, to me, what's the alternative? You know
Yeah,
what?
absolutely. I agree.
It gave me my life back. And I'm gonna just turn things back over to you, Sonia. I see Ella's got her hand raised. So
Yeah, she does. All right, perfect. That was awesome, guys. Thank you. I'll add a couple things in there too, just for 1 second, Ella, if you don't mind. When it came to my side effects, I was extreme, and I did take Dilaudid and codeine, and I still do at times. But it was like 7 days a week, pretty much. Like for a year, I was pretty much in bed. We discovered, so there's a low percentage of people who get myalgia pain from these medications. I was one of them. I am one of them. So I think it's only like 8 or 10% that it happens to. So I am not the normal. So, you know, I don't want that to scare you or anything. But we also discovered that I went to a live blood therapist, and my B12 was extremely low, not dangerously, but getting there. And one of the side effects of that is myalgia and muscle pain. So since we have discovered that, it's not near as bad. But I can tell you, I attended many meetings with PHA Canada and stuff in bed on codeine and stuff like that. So don't forget in all of this that not only are you a PH patient, but you are a normal person patient who can have other things go on with you, because it's so easy to blame things on pH or blame things on the medication. And that's what we did for years. We blamed it on the care pool, but it wasn't. It was my B12. So, you know, always remind yourself that there's other things that can go on. All right, I'm going to give it over to you, Miss Ella.
There, unmuted. Sorry. What I was going to say after being on Carapul for the last 3 years is my doctor is a firm believer that when you're on that Carapul, you are responsible for your pump, you are responsible for your mixing, and having a second person help that knows how to do the mixing. Because if you go into hospital, it is still your responsibility to do it. Do not let the staff at the hospital do it, because a lot of the nurses don't know how to mix it. And we learned that the hard way. I got very sick because a nurse did not know how to mix it properly. The IV bags that we get for our Carapul range up to 10% more than what is actually written down on the bag. So it could be 110 mils to 120 mils. In my particular case, they were taking and reconstituting the Carapul with 5 mils into the little vial bottles and then drawing it out and shooting it straight into the bag. So I was getting a very weak dose. And then when I switched over to my pump, I was getting what I was actually supposed to be getting, and I was very sick. The other thing that you want to watch for is if you get taken in an ambulance and they see your Hickman line, you have to emphasize that nothing can be taken out or added into your Hickman line, because it will interfere with your drugs.
Yeah. I'm just going to add to that actually as well. So, Carl, you said you have the single lumen, right?
Me? Yeah, I just
Yeah.
have a single lumen, yes.
Okay, so I had the double lumen, just in case one of them failed.
Mhm.
And the only time that I was allowed to have blood drawn from my other lumen, and that's what the second lumen was there for, is if an infection was suspected actually in my line. So twice only I've had it drawn from my second lumen. And with the pumps, whenever you were saying about having 2 pumps or whatever, my team said that I needed to have 3 because, you know, you have one and it fails and you have to use the other one. Well, within that 24 hours that it takes to get to you or whatever, the second one can fail. It can happen, and it did happen to me. And I actually had 3 at the time. So 2 of them failed, and I was down to 1 pump. Very rare, but it can happen, and it did happen. And so, I would suggest to anybody that you get 3 pumps, and then you have 2 backups, and then you can switch them out every time is what we were told to do, is, every time switch it over. So I actually labeled mine 1, 2, 3. I don't know if that helps anyone. There was something else I was going to comment on too. With the nurses.
I've got something, Sonia.
Yeah, go ahead.
Oh, no, go ahead.
With the nurses, Newfoundland is obviously a Labrador, a lot smaller population than, the rest of the provinces, but we have specific staff, specific nurses that are trained on our medicine unit, respiratory unit, for pulmonary hypertension and mixing our medications and things like that, just in case we are too ill and can't. My husband used to work offshore, so there was a lot of times that I would end up in hospital and he was away. My 2 adult children have also been trained in making the medication. So if I had a really sick day or whatever, sometimes here at the hospital, here at home, the 4 of us would sit down and make up 2 cartridges each, and it would just take us no time. So that was very helpful. So, and they will train one other person for you regardless, but my whole family was trained because of my husband. The other thing is in ICU, where I've spent some time, the nurses there typically, I think they have to make your medication. And I don't know what it is about that, but I know my PH nurse trained them, and they did make my medication for me. So different situations, I guess, call for different things. But yeah, anyway, I just wanted to add that.
There you go. Okay, I'd just like to add to that. Yeah, my family is trained too. My husband, my eldest daughter, because when we're traveling, we need that. We didn't really touch on traveling with all this stuff, but that's a story for another day in another session. But if, especially in like Sonia's case, I don't know where you live, Carl, or where our folks, our guests that are with us today are, but if you're on an IV infusion drug, it's a good thing. I've done it. Many people are too embarrassed to do it, but contact your local paramedics, contact your local fire department, give them an emergency sheet. I believe PHA Canada has an emergency style sheet that you can fill in. If not, I will work with them and see if we can get one to happen. Somewhere along the line, I got one or a rough copy of one. I filled mine in and I handed it in, and our local fire department paramedics, our fire departments volunteer. They're literally behind my house. They stop in once a year to see any updates to be done on my paperwork. But going into an ambulance, there's so many things can go wrong with us that they would treat us as a normal person. But because of our drugs, if they were to give me Ventolin with the drugs I'm on, I won't make it to the hospital without no blood pressure. It'll tank right out. Yeah. Because the Ventolin has, it reduces your blood pressure if you're on Adcirca.
Yeah. Yeah.
And I have a drug allergy, like a medical allergy to alcohol. So they can't give me
anything alcohol-based
drugs at all. And it's crazy.
Wow.
It'll happen. So having a medical alert bracelet on you or a necklace, plus the paperwork into your paramedics and your fire department, can be a lifesaver.
Yeah, my PH team, they sent the letters to the paramedic department and to the ER. And I know at one point I went into the ER for whatever reason, and the triage nurse said, "Oh, we just did a seminar about you." But that's small population as well. So yes, go ahead.
I was just going to say, I forget one more of a couple other things I forgot. It's amazing how I should write this stuff down. But also, and I'm sure it's the same for Marion, she can confirm or not, but also twice a week, I have to replace the lines on my
Yes.
pump, which is from the Hickman line to the actual pump. So twice a week. I'm Mondays and Thursdays, so the days that I do it. That I also replace, the long line that comes along with what we're doing, and that's just a maintenance thing. I also have a small backpack that I have that I got the Red Cross, first aid emblem sewn onto the back of it, and inside that I have a small little case that I think we got it from a dollar store somewhere, and inside there, I've got my extra needles and I got extra this, so when I go out, I wrap up an extra cassette in a little ice pack that I keep in there. So when I have to go out and do something, I carry that with me. So God forbid I have a problem with something, I can switch out because my extra pump is in that well. So that also becomes a companion. Now I have to admit, after 3 years, I'm a little lazy. You know what? If I'm just popping up to the store and back, I'm not packing all that stuff up to go.
I know.
But if I'm going to be, an hour from home or someplace where it's not that convenient to get back home if I run into problems, absolutely, that pack goes with me everywhere. When I leave the house for any length of time, and that's just, again, I've never had a problem with it. I had one pump fail, but it failed at home.
Me too.
A little weird story. I'll tell it anyway, because of course, when you go on the stop, they're telling you can't be disconnected from that thing. Otherwise,
it's 6 minutes, Carl. I meant to say that it's a 6-minute half-life.
That's what they say, 6 minutes. Otherwise, and there I am thinking, in 6 minutes, I'm going to keel over if I don't have my pump. But just an interesting little story. I switch out my pump between 11 and 2 every day. I don't have I'm not that anal about what time, but between about 11 and 2 is when I get to it, depending on how my day is. I switched out my cassette one day, and I went to another meeting I had pre-COVID, and we're sitting around in our group and we're talking, and after the meeting I had the fellows come up to me and says, "Geez, Carl, you're looking really good. You're looking really fine." I'm thinking, "Oh, well, thanks. I'm feeling pretty good." I got home that night and I looked and, holy shit, I never started my pump.
But
So
you
I don't recommend
great.
it, but it was like I forgot about it and I didn't keel over dead.
I know.
I think I was looking good. So let me tell you, I had a discussion with my PH team after that. Are you sure? But anyway, it was just kind of a funny little story. So
that happened to me so many times, and I stopped telling my doctor because I was really But I'll tell you how I got caught the last time. When they admitted me into ICU to put me from Carapul to Uptravi, because my doctor is like, he's not taking any chances. So he does ICU for anything like that. They went to attach my medicine, my Carapul to the hospital pump, and my pump wasn't turned off. So here they were getting ready to lower my Carapul to put me on Uptravi, and I hadn't been getting anything for 24 hours. I was like, oh my God, don't tell him, because I knew it was going to kill me.
And another little mistake that can happened to me, because when you replace the lines, there's a prime function on your pump.
Yes.
You got to prime the line, get the air out of it before you hook it all up. Well, I hooked everything all up, but opened up all the stuff, and where it said, "Do you want to continue priming?" I said, "Yes." And this thing started pumping the medication into me pretty double quick. And I wasn't very long, but it's like all of a sudden my head went, "Whoa, what's that? Quick, hit the button."
Yes.
So you know what? These are little mistakes that you can make as you get on the pump, but you know what? You learn from your mistakes.
It's worth life. And I mean, everyone, of course, has their own opinion about what it's worth to them. And I'm willing to go to no ends to live. So, and like you say, carrying a pump, having side effects, nasty side effects, days where I spent in bed, I lived. I don't care. I'm living. I'm here. So I'm okay with that.
And the little mistakes that we've all made on our pumps, we're all still here to tell the tale.
Absolutely. Absolutely.
Excellent point. We're all still here.
We are. Is there anyone who had any questions? We're glad to take questions. I will say as well that if there's anyone who wants to message me, I'm on the Facebook group Atlantic Canada Warriors and PH Friends. Certainly, if you're too shy here, you can certainly message me. And I do want to say too as well, we aren't doctors. Although I've been into this for like almost 20 years, and I actually have a lot of people ask me if I'm a nurse because I know so much about, a lot of things now. We are not doctors. We're just telling you our personal experiences with things. But if there's anything, that we've said that you would want to bring up to your doctor, I hope that sparked any information for you.
Yeah, that's a really good point, Sonia. And I think I made that, made the point of communication earlier on when I was talking. It's vital
Absolutely.
to be open and honest and communicate regularly with all your medical teams.
Yeah.
To just
Agreed.
what's going on and inform each other what's going on here or there. Like, for example, my GP has no idea or had no idea what PH was all about. So, what we were able to have conversations about that. So it's important to keep those lines of communication open. And you know what, if you're not feeling right, make sure you let someone know.
Yes, absolutely. And I know it's scary sometimes and it gets a bit disheartening and things, but the faster you get on top of things, the better it will be for you to get it, treated a little bit easier sometimes or faster. And I tell the story too. One time my numbers jumped right up, and they upped my care pool and they put me on oxygen for a couple months just to kind of bang on it as much as they could. And then within a couple months, I came off oxygen. So, there's lots of ways that they can get around things for you sometimes. So again, as Carl said, tell them, be honest, email, pick up the phone, whatever form of communication you have with your team, communicate.
Sure.
Does anybody have any questions or want to add anything? We'd love to hear from you.
Ali, you had your hand up earlier, then you took it down. So I'm not quite sure if you still wanted to comment or not.
Sonia,
Elabella?
my team sends me up to the 6th floor at HSC, which is our big hospital here.
Yeah.
And they're all supposed to be trained on the careful and how to mix it. And my specialty nurse did teach them, but they didn't follow that procedure. It was somebody that just didn't follow the rules.
Wow.
That's unfortunate.
That is very unfortunate.
And I just, after that incident, anytime I go into the hospital, we mix, like my husband mixes it, brings it in, labels it all so that there's not a problem.
Yeah.
We've only had one incident since then where a nurse wanted to have care and control of my pump. We had to actually get it written into my chart that it was our responsibility.
Okay.
Because she tried to push back on the specialist and he didn't like it. So he wrote it into the notes.
I guess he didn't like it. I mean, wow. Okay. No, I have, and I'm also fortunate too that I personally know some of the nurses on top of getting to know them from being admitted so many times, but I personally know some of the nurses, and actually my daughter's boyfriend just started a job on my unit. So hopefully I don't ever have to be on that unit again, but it would be interesting if he ended up being my nurse. He'd probably swap out.
The other thing I should have mentioned too is that I keep a 1 week's emergency supply off-site. So, and that was recommended to me by my PH team. So, it's at my daughter's, which is about an hour and a half away in Abbotsford. Not that means anything, but it's about an hour and a half away. And she has a 5-day or 7-day supply. I slips on mine now that we swap out every year. We'll go and replenish the careful and stuff. But we keep that off site, just kind of as a small little emergency backup, in case something happens with mail deliveries, or I don't know, we get an earthquake here or something.
That's a really good idea.
At least I have a supply off site, and that was a recommendation made. So that's what we do as well.
Yeah, no, that is a really good idea, actually. I mean, heaven forbid, anything could happen, something could happen to your home that you live in even, or, so Yeah, no, that's a fabulous
Yeah,
idea.
it's just enough to cover until,
Yeah.
until special shoppers gets, would be able to send out new supplies. So
Yeah, no, that is good. Keep that in mind and certainly advise people of that if they message from here. Good. Anybody else want to add anything? Miss Ella Bella, anything else? How about you
No,
guys?
Sonia.
I'm gonna pick on you. How about Marianne?
Marion, I have to thank you for your advice the last time we saw each other when I asked you about my pump and mammograms. You're right. You just flip it over to the side and it's done.
Awesome. I'm looking for the word and it's right on the tip of my tongue, but of course I can't remember it. But when you were talking, so at one time, I have no idea when it was, the nurses flushed my line and I was so sick that I didn't realize what they were doing. And what is it? Bolus? Bolus. That's what it's called. Yes. So I got like a quick flush of my medication shoot right through me, which is basically like an overdose. And it was quite nasty. So don't let anybody flush your lines because they're just, basically overdosing you with Carapul or Remodulin or whatever.
yeah, don't hit the prime button.
No. Basically the same thing, but not. Anyone, Marion, Carol, anything else you want to share? Funny stories about your lines?
I'm good.
Yeah. My friends would have get more of a fright out of something happening than myself. And so if I laid it on a chair and I went to get up or something like that, of course, last second I might think, oh, I got to go pick it up. But they'd be like yelling at me before I would even get a chance to turn around. Miss Ella, you got your hand up again?
Yes, I do.
You go.
I have learned that from my first Hickman line to my second Hickman line, if I found for myself not to take the stitch out
Really?
because they secure it with a stitch. Some people may have this problem where the line will push itself out.
Mhm.
And that's what happened to me. And mine didn't show on x-rays that it was out of place,
Okay.
but
wow.
it was. And I was getting, you know how you were talking that you got that little extra shot of
The
Carapul?
bolus, yeah.
Yeah, I got that, but I got so sick I was in ICU.
Oh my God, see? Yeah, so you
So
don't.
it all depends on the person,
Mhm.
but for myself, I would not recommend the stitch coming out. And I'm on my second line, and knock on wood, my stitch is still in and it's been a year and a half.
Wow, okay, that's interesting. I know Carl, when we were talking the other day, Carl also mentioned too about, you first get it in, you're thinking like, is this gonna fall out? And because it does move a little bit, and of course, you shouldn't move it because it can puncture. But I did have one incident in one of my lines, and it was right before Christmas, that for some reason, and apparently this happens sometimes, and it would be me, the cuff, which is like a little piece of material, we'll say, that's up inside the line, did not adhere to my tissue up inside. So it just kept slipping around, and I got extra stitches put in it and things like that, stuff like that. And then I got up one morning and I looked down and it was like way out. So my husband drove me to ER and I literally walked in like this, and she said, come in. The triage nurse, she said, if you're holding a hip on like that, you come in. So of course they got in, special procedures and had to do another one. But that is a very rare case. Anyone else? Okay, well, I'm just going to say, don't fear it. Everything is overwhelming, obviously, at first. We're always afraid of the unknown for the most part. But, even today, being on oral medication, if it stopped working and my doctor said to me tomorrow, Sonia, you got to go back on IV therapy, I'm there in a heartbeat. I'm there in a heartbeat. And it just becomes your new life, new normal, and you do it.
It's your new friend that hangs on your shoulder.
That's right. My boyfriend, I used to call it. He got closer to me than my husband.
I always like the alarms in the middle of the night because you roll over on your lining.
Oh yeah.
Squawking, the wife is grabbing me in the ribs. Shut that damn machine up. Sorry.
I think for me, one of the funniest things that ever happened was I have a CPAP and I have oxygen in the nighttime. So I had my CPAP on, and I had my boyfriend in bed with me with my husband, and my husband was snoring, so I had earphones in, and I would wake up in the middle of the night and I'd be moving my pump, and I'd be adjusting my CPAP and moving it with me, and I'd be taking my phone, which was connected to my meditation music, and flipping that over, and it was just like, oh my God, when will it ever end? So again, you just do it. Becomes habit. And for actually a lot of time after I went back on oral, I would constantly stop to go pick up my pump if I was getting up to walk to the bathroom or anything like that, because it was just memory habit to grab my pump when I got up.
It's ingrained in your head.
Yeah.
Understand that completely.
Yeah, for sure.
It's
Okay.
Just like these times of COVID, I went to the dentist finally after, because I had my 2 shots, and sat in the chair and took off my mask. It was like I was taking my pants off. It's like, whoa.
You felt naked.
Exactly. Things just become habits so quick.
I know. All right. Well, I guess we'll wrap it up there if it's all good with everyone.
Absolutely.
Okay.
So nothing going to come back on, or there she is.
All right.
Yeah, thank you so much, everyone. And again, so sorry about the delays and all the mess up, but I'm glad that we were able to get, that some of you were able to join us, and hope you enjoyed everything.
All right. Have a great day, everyone.
Bye, everyone.
Bye.
Thanks, everyone.
Thanks
Bye.
for joining us.
Thanks, Sonia.
Thank you.
Did a great job, Carl. Oh, he's gone for
You
it.
all did. Okay. Bye, guys.
Bye.